what are the types of abdominal pain? And I think this is important to think of this in a holistic way, because when I discuss this with families and children, I talk about understanding when pain is likely to be related to some underlying disease or condition which needs further investigation and assessment, or whether this is more sort of functional abdominal pain, which is very common and unrelated to anything serious. And that relates to how our brain and guts are linked together by the nerves. So you've got our brains and the little brain in the gut called the autonomic nervous system. And so this is how our feelings can also cause pain, because the nerves fire off from the brain to connect to the gut, and that can cause squeezing of the bowel or stretching, and that can cause pain. So I think this is the main distinction. And sometimes people talk about organic pain, and which is the one which is related to underlying conditions, which require specific treatment, versus functional pain, which is what I was referring to about the brain and the brain-gut interaction, which can be a nervous spell. Sometimes people describe this as. Red flag symptoms comprise a number of factors. For instance, if your abdominal pain is associated with rectal bleeding, so bleeding from the bottom, then that's something which needs to be looked into. Of course, it could have a simple explanation, such as a crack or a fissure, perianal fissure, which could be related to constipation, but of course it could be related to other conditions like inflammatory bowel disease, such as Crohn's or colitis. So is there also associated diarrhea? Diarrhea, loose stools, ongoing symptoms, waking at night to go to the toilet, having to rush. Is there blood in the diarrhea? So this persistent diarrhea would also be a potential red flag symptom. The other thing is, well, is there any associated concern about your child's growth, pubertal development? So are they losing weight, for instance? Are they shorter than expected? Is puberty continuing in the normal fashion? Because we know some conditions like Crohn's disease, celiac disease, for instance, can be associated with poor growth. In general, I think it's important to consider that abdominal pain can be caused by other conditions outside of the gastrointestinal tract, as we would consider it as gastroenterologists. And so, I think it's important to consider, for instance, in particularly a smaller child, preschool child or older child, other systems like the urinary tract. For instance, urinary tract infections can also cause quite significant abdominal pain. Now, usually there will be a clue, because an older child will complain about burning and urine burning or going frequently, but that may not be the case in a smaller child. So I think it's important to ask that question. And of course, urinary tract infections sometimes can cause loose stool as well, just because the bladder and the lower part of the bowel sit quite closely to each other. And so there can be a mix-up of symptoms. So I think that's important to consider. Firstly, make an assessment of why it's happening. It may be, if it's very severe, we've not talked about acute abdominal pain, you have to take them to the emergency department. But in this context, we're talking about pain which is recurrent abdominal pain, ongoing, intermittent, and the answer to the question is really based on what the diagnosis is. So if a diagnosis in general, it's safe, for instance, if this is happening for the first time and you're not clear, then it's very safe generally to give something like paracetamol for the pain, and this is quite reasonable and safe in most circumstances. If your child has an underlying condition, then obviously that would require treatment and specific treatment for inflammatory bowel disease or ulcerative colitis, or treatment of the urinary tract infection. But the very high proportion of pain is due to functional abdominal symptoms, and these are a range of conditions which we've mentioned very broadly, but they encompass conditions like irritable bowel syndrome, which can be associated with constipation or diarrhea. They can include a whole host of other symptoms, but IBS, otherwise known irritable bowel syndrome, is a common symptom in young people and in adults. Probably about 30% of people get some form of IBS symptoms, and this goes to how the brain and gut are linked. In the sort of functional abdominal pain, one important factor, because of course children will go to school and they have a life outside the home, and for most children the school is that big part of their life. So also considering factors related to anxiety, which perhaps bullying, which is happening at school, which can contribute, and other sort of life events which can occur in all individuals' lives, such as a change in school, moving home. These all sorts of things, just as there are big factors, or the stress factors for adults can also be stressors for children. So moving home, school, etc., peer group relationships. So these can all also influence abdominal symptoms and cause tummy trouble in children. And it's worth inquiring about that if you've got concerns, and may perhaps speaking to the school teachers, etc., to see what's happening.